Hi, I'm Ray, and I'm the owner of Rose Sign Language Interpreting Company here in Colorado. Today, I'm going to discuss the role of the sign language interpreter in the medical setting. Really, most of our work is very similar from setting to setting, but for some reason in the medical world, there's a little confusion. First of all, a deaf or hard of hearing patient will contact you to make their appointment, and they'll also request an interpreter. If you've already seen our other video, Do I Need to Hire a Sign Language Interpreter? You're familiar with this. If not, take a look at that video after you're finished with this one. So you've called an agency or an independent contractor to make sure that you have an interpreter for the appointment, and on that appointment day, that interpreter will show up a little early just to meet with your deaf or hard of hearing patient and make sure that they're a good language match. You need to understand that here in America, we're not only dealing with American Sign Language. There's a huge continuum of signed communication, and it could be ASL, but it also could be something like an English signing system. So the interpreter needs to arrive early if possible to meet with the deaf or hard of hearing consumer and make sure that we're a good language match and that we can adequately interpret and clearly interpret. So they may be chatting a little in the waiting room, talking about the weather, talking about things that are happening in the deaf and hard of hearing community. They're not discussing the medical issue per se. The interpreter might say, so we're here to look at your knee, or we're here because you have a cold, but they won't be getting down into the specifics. That's for the doctor. Next, when your patient is summoned from the waiting room, that's when the interpreter starts the work of interpreting in earnest. This is also the point when it's not helpful at all to direct comments or questions directly to the interpreter. The interpreter's goal at that time is to be the voice of the deaf or hard of hearing patient and be the hands of the hearing medical provider. Sometimes what happens is a medical provider very innocently starts asking questions like, so where did you learn sign language? How long have you known each other? Meaning the deaf patient and the interpreter must know each other because they both know sign language. Or any other type of comment directed at the interpreter. This is a little awkward to negotiate. Usually we prefer that these questions are held until the end of the appointment. We're more than happy to answer any questions you have. While we're going through the appointment, you're probably going to do vitals first, temperature, weight, primary complaint, the quick check-in. During this time, you're going to be in the room, so we will. Once you leave, we'll leave. This is another point of confusion. Many people misunderstand our role as that of a companion, or sometimes in the hospitals we've been called sitters. This is not the case. We are there to ensure clear communication. We might also do some advocacy work or some education regarding our primary function as communicators, but we do not provide companion services or nor do we have any medical training, so we're not sitters. So when you leave, we will leave. Once the doctor comes back in to discuss the patient's primary issue, we will come back in the room, start interpreting, and we will interpret everything that is said and everything that is signed. This is another point of confusion. Often people will say, don't interpret this, I'm just going to ask the nurse some other questions about another patient, or he doesn't need to know this, so don't interpret this. Really? Pardon the pun, but our hands are tied. We interpret everything that we hear and everything that we see. Deaf clients sometimes will say, turn off your voice, I'm just telling you, interpreter. This is also an awkward situation because we do have to voice these things. It's not fair to either party if the interpreter is holding information for one. It puts us in a very awkward situation. Really, we're there for both people, the hearing doctor or medical provider and the deaf or hard of hearing patient. So as we wrap up the appointment, you might have noticed the interpreter saying, oh wait, hold on, I need to clarify. Or saying, wait, can you repeat that please? Okay, thank you. Or they'll say things like, hold on, the interpreter needs to clarify. These are all very responsible moves for an interpreter to make. Remember that we are not medical experts. We may work in the medical field, but we can't understand everything that is said all of the time. We may need clarification. We may need a spelling. This is not a negative mark on any interpreter's skill. It's actually a very, very good sign that your interpreter is conscientious and wants to do their absolute best. And really, we can't interpret what we can't understand. So as we wrap up our appointment, the deaf or hard of hearing patient will be moving back to the front desk to set up their next appointment or to make their copay, whatever you do at the end of the appointment. And we may be asked to stay to set up that appointment, we may not. Really, it's 50-50. Some deaf or hard of hearing people want us to stay, some office staff want us to stay. Some prefer to do away with the interpreter because we're just an extra person. If they can get by using simple communication, they prefer that. It's really up to both of our hearing and deaf and hard of hearing consumers. So I hope you feel a little bit more comfortable about how to move ahead with your next medical appointment where you have a deaf or hard of hearing patient and an interpreter. If you have any questions, please feel free to get in touch with us at Rose Interpreting. We have a very easy contact button at www.roseinterpreting.com. You can also call us at 720-232-8370. So move ahead with this new information. Don't be afraid to ask the interpreter questions, and have a great day. Rose Interpreting.